Let's go now to New Hampshire Governor Chris Sununu.
Many small businesses in New Hampshire have made those tough choices. They've closed down. Restaurants have been forced to change their models. The people of the state are practicing social distancing, and it's important that this continues, ensuring that we all stay at least 6 feet apart from folks and making sure that we don't gather in social groups of more than 10 or more people. You're healthy at home, and especially to those over 60 years old, we urge you to please stay at home. We want to reiterate to everyone that we're constantly looking to elevate and evaluate our messaging to not only emphasize the importance of our initial social distancing efforts, but we're also constantly evaluating the response to our citizens and where our regional partners and neighboring states are moving. These variables will help determine what additional steps, if any, may be necessary as this crisis escalates. Over the last weeks and days, we've talked with other governors, hospitals, local town officials, and we're constantly re-examining those directives at the state level. We have a lot of volunteer efforts in New Hampshire that go on a daily basis, and we know that New Hampshire is truly a state of community. I'm a believer it is one of our defining characteristics. And in that spirit, we've seen many individuals step forward and offer their assistance in a variety of different ways. So today we're announcing the state's efforts to coordinate these opportunities for our citizens. The first volunteer-based effort we're ramping up is for volunteer health professionals. We've mobilized nhresponds.org. That's NHRESPONDS, NHresponds.org. And it will serve as a secure online registration system for medical and non-medical volunteers who can quickly mobilize if needed. I'm now going to turn it over and ask Commissioner Lori Shibinette to come up and talk about some of this opportunity.
Thank you. The New Hampshire Department of Health and Human Services Emergency Services Unit will be undertaking a public campaign to increase participation in our Emergency Services Advanced Registry of Volunteer Health Professionals via our nhresponds.org website. nhresponds.org is set up to pre-register, manage, and mobilize clinical and non-clinical healthcare volunteers to help in responding to all types of disasters in New Hampshire. The NH Responds Volunteer Management System is a part of a nationwide effort that was established after 9/11 to get medical professionals quickly and properly deployed during public health emergencies or disasters. Since NH Responds was established, we have built a voluntary reserve corps of medical providers, first responders, and emergency response professionals and behavioral health providers. Some of our divisions under NH Responds includes New Hampshire Disaster Behavioral Health Response Team, which we use regularly, the Medical Reserve Corps, and even the New Hampshire Disaster Animal Response Team. These registered volunteers have more than a decade of experience to responding to emergency situations across the state. Our volunteer corps has been sufficient in previous crises to respond, but for COVID-19, it's a challenge that is unprecedented in our state history and requires an unprecedented response. We need more volunteers to step up and help mitigate this pandemic. Registering is very easy. Go to nhresponds.org and click on the Register Now button. We are looking for licensed medical and healthcare volunteers to satisfy the clinical needs and provide surge capacity during the COVID-19 emergency. If you can help, you do not need to have specific medical training. Our response requires all types of skills and expertise, including nurses, doctors, respiratory therapists, interpretation, administration, transportation, information technology, security, and almost anything else. This is an all-hands-on-deck moment for our state. We are tirelessly working to respond to the COVID-19 crisis, and we need your help. Please go to nhresponds.org and learn more on how to register. Thank you.
Great, thank you, Commissioner. Next up, we're announcing ways that any citizen who has the ability to lend a hand can help. New Hampshire is blessed to have many amazing nonprofits which do critical work 365 days a year in virtually every community across the state. Especially in times like these are the organizations that do an incredible job stepping up and providing that one-on-one interaction with folks when they need help the most. If you're interested in volunteering for just a local nonprofit, the team at Volunteer New Hampshire can connect you with an organization in your area. and operate, if you're folks that are operating a nonprofit, you can register your organization with Volunteer New Hampshire as well. Simply go to volunteernh.org, the volunteernh.org website, to volunteer yourself or to register your nonprofit to help make the connection for individuals who simply want to stand up and lend that helping hand, to the organizations that are looking for more folks to, again, create that one-on-one contact with individuals as we go through the COVID crisis. We also want to talk about two great organizations that have really stepped up and partnered in a really amazing way. On the charitable campaign efforts, folks that want to maybe write a check, whether it's $5 here or for corporations who are looking to make more sizable donations into the efforts to make sure that their funds can go to a local nonprofit or a local organization that's fighting the COVID-19 effort alongside with us. The United Ways, who can be reached at uwnh.org, that's uwnh.org, and the New Hampshire Charitable Foundation and their Community Crisis Action Fund. These two organizations are teaming up, and they will direct 100% of what's donated directly to agencies or people in need. The New Hampshire Charitable Foundation will be working more on the nonprofit organization side, while the United Ways donations will be more working with individuals with that direct need. Again, these are two organizations that have come together just in the past few days, created an opportunity to make sure that no one is left behind, no organization is left behind, and those who want to contribute and lend that helping hand are right there to make it happen. I guess with that, the last piece we want to really talk about is businesses. We talked a little bit about manufacturing businesses over the past couple of days. The fact that now we have over 100 manufacturers in just the last 48 hours that have stepped up, that have contacted the state, asked how they can be involved, whether it's creating devices or PPE, medical supplies, whatever it might be. A lot of these manufacturers are retooling. They're restructuring their entire organization to meet the needs of the COVID-19 crisis. And again, we just cannot thank them enough, to be sure. There is a website for those folks as well that would like to be part of those efforts. It's nheconomy.com/PPE help. nheconomy.com/PPE help. And again, this will allow for businesses to step up, enter a portal, if you will, online, describe what your functionality is and how you, as an organization, may be able to help with the supply chain to ensure that at the end of the day, our hospitals and our communities have what they need to battle the COVID crisis. With that, we can open it up for questions.
As far as medical volunteers, are those folks who maybe are retired now, doctors, nurses, are they allowed to jump in and help out as well?
That's exactly who we're looking for. We're looking for those that have retired from practice, people that have gone into more an administrative role, maybe doctors and nurses that may be furloughed right now. We're looking for all healthcare professionals that either retired or active. So we are happy to help them move barriers when it comes to licensing. They just need to contact us.
As far as the peak, Governor, I don't know, Commissioner can speak about this. When do you expect that to happen? 1 week, 2 weeks, 3 weeks down the road?
I think it's a little early to say just yet. I think that based on modeling, and there's so many models right now, and a lot of our partner healthcare facilities have done modeling. The department has done some modeling. We expect that we are still in the escalation phase of the pandemic, so I think that we can expect to see higher rates for the next several weeks, and probably peaking, I would say, April into May, but definitely seeing escalating rates over the next couple of weeks.
Governor, some states are asking people who are coming back from areas of the country with high rates of the virus, New York, California, Washington, to self-isolate for 14 days.
Absolutely.
Look at here, folks are coming back to New Hampshire from New York or other states.
Yeah, anybody who's been traveling out of state, we very strongly recommend that they again take that very seriously. They self-isolate. It's kind of a message that started a few weeks ago when the university system was looking at the concept of spring break and students possibly coming back. They put a stipulation of anywhere with more than 100 cases. At this point, we just want anybody that has been traveling out of state, out of their community, and into areas where they don't normally travel, to again take that self-quarantine very seriously. It's going to be a big effort. And again, we're really trying to elevate the message here. People have to take this seriously. We've seen the people of New Hampshire respond very, very well, but we want to make sure folks understand we are in this for the long haul. This isn't just a week or 2 weeks, as the Commissioner mentioned. The surge could happen 3, 4, 5 weeks. We don't know when it's really going to hit its peak. So until then, we have to be very, very vigilant about our personal responsibility with our businesses, with who we interact with, and take the concept of isolation very seriously. And if I may also, the fact that we are now going to be tripling over the next day here or so, we're tripling the number of tests that the state is able to do, and that's an amazing opportunity we have at the state. So I think the Commissioner would agree that we're going to see a huge surge in the number of reported cases of COVID across New Hampshire in the next couple days. That is absolutely expected because we're simply getting much better at identifying these individuals, and will allow us to, again, isolate those individuals much quicker, get them out of, make sure they are isolating and getting them out of their contact system, and that again helps really suppress the potential surge. So there will be a surge here. It's all about making sure that we can suppress it to the level that we manage and don't overrun the healthcare system.